Hello there, everyone. This is Miriam, holistic life coach and mind-body practitioner from Pain Outside the Box. And today I'm going to be discussing the kind of meaning that we tend to give our chronic pain or symptoms. So what do I mean by meaning? So if we were to observe any painful or uncomfortable sensations in isolation from their implications and their consequences, we might realize that these pain or sensations may not be as distressing to us as they currently are. So basically, people who suffer from chronic pain or symptoms don't just have to deal with the intensity of the pain and the symptoms, but they also have to deal with a lot of thoughts surrounding them, with a lot of potential implications. And by doing so, by thinking about these consequences or implications, we are actually giving more meaning and weight to our symptoms. Now, the TMS and neuroplastic pain approach to symptoms requires that we stop giving our symptoms a certain weight or importance. So it requires us to change our perception, the way that we perceive our symptoms, in order to obtain what I like to call a mindset shift, a shift in the way that we perceive our chronic symptoms. This shift in itself will automatically lead to a decrease in symptoms and sometimes even to complete improvement. So, let me give you a few examples so you can relate. So, someone with intense or regular sciatica pain would naturally start thinking about his or her future. Would he be able to work at all? Would he have to quit his job, end up on a disability benefit if this goes on? Would he need surgery? Would this ruin his life? And all of these things make this current temporary problem into a bigger problem, right? And not only that, when we start thinking of these implications and possibilities, we also start programming our brain and body to keep producing these symptoms, because what we expect can become true in the case of mind-body syndrome, right? If we expect to be in pain at a certain place, at a certain event in the future, we are more likely to feel the pain because we would be building up this anticipatory anxiety and we would be looking out for the symptoms and being hyper-vigilant, and that would make it even more likely for us to feel the symptoms, not to mention the stress of knowing that we might get symptoms during a specific event. So since pain is linked to stress and fear, it's more likely actually to get these symptoms during a specific time if we fear to get them during that specific time. So in this video, I'd just like to encourage you to become a bit more aware of the additional weight that you're giving your symptoms. Because let's face it, if you knew that you had to live with these symptoms just for the next 2 days, would you feel that much fear, that much frustration or annoyance at having these symptoms? Or would you be actually okay despite the physical pain? Because the answer to that most people give me is that they would be totally okay if they knew that the symptoms would go away. So what causes most of their distress is their thoughts of having pain in the future, for God knows how long. And these are the very thoughts that we need to start changing in order to reprogram our brain and body for pain-free. And by having these thoughts, we are giving the symptoms so much weight and importance, because we are making our whole life and our whole happiness dependent on whether we have symptoms or not. This is what most people end up doing. It feels like their happiness hinges entirely on whether or not they're going to have symptoms. So we can see how much meaning and weight they're ascribing to these symptoms. But in reality, to actually overcome these symptoms, we have to give them a different meaning. And there are two ways of doing this. So one way is to think psychological about these symptoms. I have a whole video dedicated to this, and it's basically figuring out why you might have these symptoms, why you might have gotten them in the first place, what they're trying to tell you about anything that has happened or is happening in your life. So to mention the most obvious example, you might be having neck pain because you're under a lot of pressure and stress because there's a deadline that you have to meet, and there are all sorts of fears around this deadline. What if you don't manage? What if the project is not good enough, etc., etc. So in that case, you would get the neck pain. Instead of starting to worry about what it means, whether you're going to get it in the long term, whether it's your posture that's creating it, and so on and so forth, you would actually make the connection between this increase in neck pain and this deadline and the stress that this deadline is creating for you. So that's one way. So think psychological about the symptoms. The other way to stop giving meaning to your symptoms is to actually change your perception of them and to view them as temporary sensations. It's to automatically stop and catch yourself each time that you're having thoughts about the future, okay? I like to call it the stop technique. It's actually catching a thought, saying stop, telling yourself to shut up and just not go there, to try and stop the spiral of thoughts, okay? And also then to observe the symptoms as they are, as a present moment sensation. And there are various ways of doing this, mainly through meditation and also somatic tracking, where you get to observe the symptoms in a more curious way, okay? When you get to accept them a little bit more instead of trying to resist them, okay? Because when we accept them, we are changing our perception, okay? We are actually training ourselves to be okay with them in the present moment. So yes, that's basically it. For now, I would just encourage you to look at the way in which you are currently perceiving your symptoms, what kind of implications you are envisaging, what kind of meaning you're giving them every day, each time you think about them, okay? Each time you think about any consequences for your future, and try to let go of the future and focus on the present moment, okay? Because if you're in chronic pain, you might already know that your pain levels may change from day to day, that everything is temporary. There is no one sensation that it's totally constant all the time. Hardly ever, if we really notice it. We can always notice some changes, and that's good news, okay? Because it means that things change. The body is not static, our pain levels are not static, and they can change for the better. So that's all from me for today. Just stop giving meaning to your pain and see what happens. Bye-bye, and see you again next time.